kuyilento ye forensic pathology services ngabonga nje ukuthi umnumzana uKhika engangibongeli kahle hle kodwa ke kunjalo nathi asiblame ukuthi asenzi kahle ngithe HOD ngizoyisho nje obinjalo asenzi kahle nge-forensic pathology services abasebenzi abakwazi ukuthi njena bamane bonke bathi abazile emsebenzini kukhona into ethile kukhona ayinuki ngosiwe kusho ukuthi kukhona esingakwenzi kahle ngakho ke lento ngisho HOD kukhona okuhle sikwenza kodwa le ayihambi kahle ngase ngiyamthasa HOD lungisa izinto nama union ukuze uphele ukuthi sihleli ngesinqe sodwa singazi ukuthi bazoteleka nini abantu kusasa kukhona njengabe siyakulungisa kalula lapha ukuhamba ke siyosebenza lapha ke kwangekona abantu ukuqhakambisa ukuthi siyakwazi ukuhlinza idumbu kwakukulekelela njengoba HOD wesaxakeke ukusolve leza zinto ukuthi ngesikhathi esolve ke yena sibe sibahlinza abantu bakwazi ukungcwaba sibuziwe ke ungqongqoshe kaZwelonke ukuthi ke lento evele eGauteng yasesidimeni ayikho yini kwiprovince yeni KwaZulu-Natal na sathi cha ngqongqoshe asikwazi ukuphika ake siyoyibheka ngifuna ukukunikeza ke ireport la ethi ngeke ngayethula ke na kwicabinet cha siyabheka kuhamba kahle imental health noma njalo kohlala kuyizidingo zabantu ezinganakiwe noma ikumuphi yizwe imental health service iyohlala ingemuva kuwo wonke amazwe neyakwaZulu-Natal ke ngeke ngiyiqhakamise ngishaya isifuba ngithi sezingene eliphezulu kodwa I'm happy to announce ukuthi we have all our facilities on the top of the range lapho nje kunebhuku elingase nilibone bahlonishwe lihle kabi elikhombisa ibhedlela ezi top class buka iFort Napier lapho isibhedlela sinjani ubuka iTown Hill ubuke isibhedlela umzimkhulu hospital nemadadeni top class ibhedlela egade abantu bethu abagulayo nabagula ngengqondo sihamba sodwa sinconywe nawe uZwelonke angeke ngigcizelele ke ukuthi ke lokho sikugadile sikwenza ngendlela enhle encomekayo engagcina ukunconywa nje ethini eKokstad sifikile nakhona kukhona into ekuthiwa i-palliative care ukugada abantu bese inhlungwini begula kakhulu ngezifo ekuthiwa ama-dreadful disease siyajabula ukuthi i-palliative care enganginikezwe ungqongqoshe kaZwelonke ukuthi ake ngiyilide ngibe usihlalo wayo hayi Thula Rogers sahamba sithule umbiko wokuthi palliative care sesine policy manje inqubo mgomo yokuthi palliative care soyenza kanjani KwaZulu-Natal South Africa yonke angikusho uthini kukhona into esayenza la esithi to make me look like a hospital sayiqala kudala lento sasingazi kanti sisiza kangaka sisiza ngoba sitheme sesingena phansi kohlelo le-National Core Standards sigadwa ama-clinic nezibhedlela ngifisa ukusho nje nisibongele nala kwi-opposition ukuthi mesigadwa sikalwa iSouth Africa yonke kukalwa ngokwama-district ama-district ahamba aku-top 3 in the country uMajuba ulandelwe umzinyathi sengalandela-ke namanye ama-district in the whole of South Africa all the time siyakubonga ke lokho ngoba nomgungundlovu uhlale ukhona kwi-top 3 I'm talking about the whole country ena 56 districts into yokunconywa leyo ngoba iyabanikeza abasebenzi bethu yonke iSouth Africa ukuthi benza kahle abaqhubeke benze kahle siyakubonga ke lokho kulento ekuthiwa u-ideal clinic kukhona phela sikubhalile ngegama lakhe okwanconywa ku-national angikujombe ngoba ngiyasibona isikhathi sami siyahamba siyancipha impela kuthiwa siqinise national ngiyavuma inhle uMalale Veva awusahambi kahle ezweni lonke naKwaZulu-Natal angithembise lo mgwamanda ukuthi soyilungisa leyo nto ayihambi kahle kukhona lapho kunezikhala khona sifuna ukuqinisa ingabuyi imalaria ngoba ukuba khona kwemalaria emkhanya kude kushonisela phansi iSouth Africa yonke sikalwa ngayo thina la kule ndawo esikuyona ake ngithi ke kulolu hlelo lokubuyisa abantwana eCuba sesisenhlelweni yona province kuphela le eseyinhlelo ngisho Western Cape hayi Western Cape ayinalo lihlelo ngoba vele babekho abantwana lebafundisa eCuba sineyinhlelo zokuthi thina lo mthamo ozobuya eCuba uzoba umningi kakhulu ngeke bakwazi ukuqeqeshwa bonke eKing Edward naseGrace ngakho ke asibalungiselele bayoqeqeshwa ezibhedlela isemakhaya sesenzile ke Newcastle sebe ready siyalungisa nasePortshepstone naseNgwelezana ukuthi babe ready labantwana sibathumele khona sebenzisana neUniversity of KwaZulu-Natal siyazilungisa inhlalo bazobe bebuya ngonyaka ozayo ngoJuly abantwana abawu216 18 bonke beke bahlala eThekwini naseMgungundlovu bohamba siyobathumela lezi zibhedlela esemakhaya basebenze nakhona ngoba kakade vele indlela abatrainwe ngayo eCuba batrain basebenze emakhaya hayi endaweni ephephethwe umoya kakhulu. Ake ngethuleke lolu i-medical legal plan ingabe nisayingena sinohlelo olu-right kuneplan la sengayibika kwicabinet icabinet ithi lolo hlelo thina siyavuma ukuthi le nto yenziwa abameli yokuhamba beyohlala ebhedlela zethu balinde bathi oza ngala ubani okwenzeni esibhedlela oza la sifuna ukumbopha i-wrong leyo nto okuthiwa i-touting sifuna i-law society idile nale matter yokuthi abameli abanjani laba bona bazi ukuthi bayohlala ebhedlela zethu asisho ukuthi nasifuna ukubakhokhela abantu nasenze khona inkinga kodwa sithi uma zibe khona inkinga asibe nohlelo sixoxisana nemndeni sibanikeze certificate sokuthi uma belimele sokwazi ukuba lapha into ethi future medical plan. What do we plan? Ngoba le mali ezama million no 20 million ingene ephaketheni labameli baphinde beze ebhedlela zethu bezofuna ukulashwa sizobanikeza abantu imali bahambe olungisa umuzi wakhe ukuthi ukwazi ukungena i-wheelchair mhlawumbe isibani noma umbhede wakhe ube right kodwa into yama future medical services sigodle sibunikeze certificate ithi uphathe certificate ufike esibhedlela sokungenisa phambili uzo save imali ngoba leyo mali vele abayidli dliwa abameli abazisu. You just cannot be successful if your service are going to cover that committee and not the rest. That is why I'm saying no one should be left out of the service from cradle to grave. So universal health coverage is one of the key. And we are also saying we need to strengthen our systems. Systems are going to actually make sure nobody falls into the cracks, because if people fall into the cracks, into the systems that we create, guaranteed we are not going to wipe away any of the illnesses. Countries that have actually wiped away certain diseases have actually had to tighten their systems. I realize we are sitting at this area called SADC, and we have been called upon and we are given a name called E8, that we must eliminate malaria. And countries up there are not going to eliminate malaria, but they can reduce. All that can only happen if you have your systems tightened up. We need to also focus on the programs that once upon a time were MDGs 4, 5, and 6, now focusing on to improving the maternal mortality. We need to actually drive that. We would want to say, among other things that we are having our strategic goals, is reducing infant mortality to at least less than 20 babies dying in 1,000 that will be born at a particular time. Reducing our under 5 mortality. So once we have it, but driven by that is to have South Africans having a long and healthy life beyond 70. So those are key strategic goals that we are going to be driving as a department. In national health insurance, people would have wanted to see it much faster and better than what it is. But in any concept, any proposal, any new policy will need people to drive it. It's an ambitious plan that we can tell you we want it to take place. And it has got its own successes in this province, in some of the treaties. But we are the only province, in fact, I always say this, if there's any province in the country where you must actually come and see NHI, it is our province, because we are the largest. We have 3 districts that are piloting NHIs, Amajuba, Mzinyati, and Mgungundlovu. Where we see our failures in any of those 3, we take them, and where we see our successes, we deal with them and take them and transport them within the province. Therefore, we are likely to make an impact quicker and better. I've always been saying, but until we get everybody to buy into it, which is something I'm going to talk about very strongly, everybody must buy into this, because really health for all is a moral obligation. Those who have resources must be prepared and be available to carry along people without resources. That's what it says. It's a moral obligation to carry along. So we must be all ready and willing to do that. Yes, what we saw at Nkosi Albert Luthuli is one of the success stories that we saw. And I think this year we have recorded 2 main ones. One was when a nurse at Shaka's Crowd Clinic made a diagnosis of what looked like a distant heart sounds on a fetus. That baby eventually was delivered at Nkosi Albert Luthuli successfully through an operation called pericarditis. I don't know what it is, but it's a very serious operation where doctors were pushing a needle through the mother's tummy into the chest of the fetus right next to the heart and suck the fluid out. And that's why the baby was able to stay in the mother's womb for 2 more months before delivery. So one of the success stories. But another one is where those Siamese twins delivered at Cheletuba, Pongola, eventually went to Ngwelezane and later went into Nkosi Alpetutuli, were successfully separated thanks to almost about 15 specialist teams, nurses and doctors who made that success. So look, we have our own challenges, but we also have a lot of good stories to tell. And the NHI is saying to me, if that poor lady from Pongola had to have her children separated, she probably had to assemble more than, I don't know how much, probably more than 10 million. So she had a choice to either leave her babies to die or come to a government hospital and get all that sorted out at no cost. So that is what it means to really be focusing on issues of national health insurance. Let's carry each other's burdens. Those who have got resources, put your resources into a big pool of a basket where that pool can be equitably distributed to all those who might actually not be having enough. Otherwise, that family, if they insisted that they wanted to have their babies alive and well, and there was nobody and no government willing to help them, they've gone into what we call in health a catastrophic health expenditure, where you end up having to sell your car, your house, sell some of your children to make sure that this only child survives and get medical. So that's what we call a catastrophe. A family that otherwise was doing suddenly well gets into a catastrophe because of what they are exposed to. Until and unless we get into our vision that let's carry each other's burdens. Let us not have health be available to only those who can afford to, but let it be a universal coverage for even people who can't afford. That's the way that we want to go.